Vitamin deficiencies are common worldwide. Vitamin deficiencies can affect anyone and usually coexist with mineral deficiencies. Albeit often clinically unrecognized, some mild deficiencies can have significant adverse effects. There are a variety of vitamin deficiencies, including vitamin A and vitamin B12 deficiency. Each has harmful effects on your health. For instance, a vitamin B12 deficient person can have anemia, while a vitamin A deficient person can cause weak bones and teeth. Have we got your attention now? Continue watching to learn more about the dangers these vitamin deficiencies pose to your health. Number 1. Vitamin A deficiency. Why vitamin A is important? Vitamin A is an essential fat-soluble vitamin. Ever heard of skincare products emphasizing retinol or retinoid? Vitamin A itself is the compound retinol, which helps in forming and maintaining healthy skin. In addition, vitamin A helps with the production and maintenance of healthy teeth, bone, and cell membranes. Effects of vitamin A deficiency. Vitamin A deficiency is prevalent in many developing countries. It can cause both temporary and permanent eye damage. In severe cases, it can cause blindness. In fact, this vitamin deficiency is the global leading cause of blindness. Also, it can suppress immune function and increase mortality among children and women. Other signs and symptoms of vitamin A deficiency include skin dryness, itching and scaling, dry eyes, night blindness, infertility and trouble conceiving, delayed growth, throat and chest infections, poor wound healing, acne and breakouts. Boosting your vitamin A. Because vitamin A cannot be produced by the human body on its own, you must incorporate them into your diet. There are two types of dietary vitamin A: preformed vitamin A and provitamin A. Preformed vitamin A is found on animal products such as poultry, dairy, fish, and meat. Meanwhile, provitamin A is found in plant-based foods like fruits, example oranges, mango, and melon, and vegetables, example sweet potato, carrot, spinach, and lettuce. Number 2. Vitamin B1 deficiency. Why vitamin B1 is important? Are you familiar with thiamine? It's otherwise known as vitamin B1. It's an important part of the nervous system. It also helps the body convert carbohydrates into energy as part of the metabolism process. In addition, thiamine plays a role in muscle contraction. It can even prevent diseases like beriberi, which involves disorders of the heart, digestive system, and nerves. Effects of vitamin B1 deficiency. Vitamin B1 deficiency can lead to nerve and muscle damage and can affect the heart. One of its common health effects is beriberi, as mentioned previously. In some cases, it can cause anorexia as well as mental problems. Other signs and symptoms include fatigue, weight loss, blurry vision, nausea and vomiting, shortness of breath, confusion, irritability, short-term memory loss, weak muscles, reduced reflexes, tingling sensation in arms and legs, cardiovascular symptoms like an enlarged heart. Boosting your vitamin B1. Eating a healthy, balanced diet that includes B1-rich foods can help prevent succumbing to thiamine deficiency. Some good sources of vitamin B1 are beef liver, macadamia nuts, lentils, black beans, asparagus, pork loin, and fortified breakfast cereal. Number 3. Vitamin B3 deficiency. Why vitamin B3 is important? Vitamin B3, or also known as niacin, plays a role in turning the food we eat into energy. It helps the body utilize proteins and fats. In addition, vitamin B3 keeps the hair, skin, and nervous system healthy. Although many people don't easily get vitamin B3 deficiency nowadays, factors like low tryptophan diet, undernutrition, and low intake of B2, B6, or iron can lead to low levels of B3. Effects of vitamin B3 deficiency. Before, niacin deficiency was a common problem. Thankfully, these days, most people get enough vitamin B3 in their diet. For those who have vitamin B3 deficiency, they may experience symptoms like bright red tongue, rough skin appearance, pigmented rash on the skin that's exposed to the sun, fatigue, vomiting, constipation, and diarrhea, headache, depression, memory loss, hallucinations in severe cases. A severe lack of vitamin B3 can also lead to pellagra. This condition can be fatal, so be careful. Boosting your vitamin B3. The human body excretes any niacin it doesn't need in urine. It also doesn't store niacin, so people should get it from dietary sources every day. Good food sources of vitamin B3 are beef liver, turkey breast, grilled chicken breast, dry roasted peanuts, brown rice, and enriched breakfast cereal. Foods rich in tryptophan are good sources of niacin. When there's excess tryptophan, the body converts it into niacin. Number 4. Vitamin B12 deficiency. Why vitamin B12 is important. Vitamin B12, or also called cobalamin, is a water-soluble vitamin that's essential for optimal health. For starters, it's necessary for blood formation and brain and nerve function. It also helps make DNA, as well as help prevent megaloblastic anemia. Effects of vitamin B12 deficiency. Vitamin B12 deficiency can be slow to develop. Thus, symptoms may appear gradually, then worsen over time. On another hand, it can also be relatively quick. There are an array of symptoms for this vitamin deficiency, so it's often overlooked and confused with something else: weakness, fatigue, anemia, a swollen, inflamed tongue, staggering walking or balance problems, difficulty thinking and reasoning, memory loss. Boosting your vitamin B12. Every cell in the body needs B12 to function normally. However, the body itself cannot produce this vitamin. As such, it's crucial to get it from food or supplements. Plants don't make vitamin B12, which is why vegetarians and vegans are usually at high risk of developing B12 deficiency. Food sources of vitamin B12 are shellfish, eggs, meats, milk products, and shellfish, to name some. Number 5. Vitamin C deficiency. Why vitamin C is important. Also commonly known as ascorbic acid, vitamin C is vital for the growth, development, and repair of body tissues. It's used to make skin, ligaments, tendons, and blood vessels. Additionally, vitamin C helps the body absorb iron and even boosts the immune system. It promotes wound healing as well. Effects of vitamin C deficiency. It's typically rare to get vitamin C deficiency today due to the availability of fresh produce and the added vitamin C boost to certain foods. Although symptoms of severe vitamin C deficiency can take months to develop, you must also watch out for some subtle signs: rough, bumpy skin, bright red hair follicles, slow wound healing, poor immunity, painful swollen joints, weak bones, bleeding gums and tooth loss, corkscrew-shaped body hair, spoon-shaped fingernails with lines or red spots, dry, damaged skin, easy bruising, fatigue and poor mood, unexplained weight gain. Boosting your vitamin C. Because vitamin C cannot be made by the human body, we must get this from our diet. Luckily, we have an abundance of foods that are loaded with vitamin C, including citrus fruits, example limes, lemons, oranges, and grapefruits, kiwi fruit, cantaloupe, melon, and veggies such as tomatoes, spinach, cabbage, and broccoli. Number 6. Vitamin D deficiency. Why vitamin D is important. The body needs vitamin D to absorb calcium and encourage bone growth. It helps with strong bones and may help prevent some cancers. Moreover, this vitamin aids in regulating the immune system and the neuromuscular system. It even plays a significant role in the life cycle of human cells. Effects of vitamin D deficiency. Unlike the previous one, vitamin D deficiency is very common worldwide. The majority of the people with this problem do not realize it, as symptoms are generally subtle. The top signs and symptoms of vitamin D deficiency are as follows: fatigue and tiredness, often getting sick or infected, depression, bone and back pain, muscle pain, hair loss, bone loss, impaired wound healing. Boosting your vitamin D. Despite being an essential nutrient, vitamin D is not adequately received by many. To boost your vitamin D levels, you can get them from being in the sun and eating vitamin D-rich foods, like fatty fishes, mushrooms, egg yolks, fortified foods, and dairy foods. Which of these vitamin deficiencies is affecting your health? Have you ever thought of eating your way out of these health problems? Comment your answers below.